the impending cuts to USAID funding for HIV/AIDS programs in Africa are nothing short of catastrophic, a potential death sentence for hundreds of thousands of mothers and children, according to leading experts. The sweeping termination notices, impacting organizations across the continent, signal a looming humanitarian crisis of unprecedented scale. The scale of the cuts, exceeding 90% for many key USAID contracts, translates to a staggering $60 billion, £48 billion reduction in overseas aid. This dramatic slashing of funding threatens to unravel decades of progress in combating the HIV/AIDS pandemic, jeopardizing the lives of millions. The Elizabeth Glaser Pediatric AIDS Foundation, EGPAF, a vital player in the fight against pediatric HIV, has already received termination notices for 3 major projects, impacting over 350,000 individuals, including more than 10,000 pregnant women living with HIV. These women rely on antiretroviral drugs, ARVs, to prevent mother-to-child transmission, and the cessation of these life-saving treatments will have devastating consequences. Dr. Lynn Mofenson, a senior advisor at EGPAF, poignantly describes the decision as a death sentence for mothers and children, a stark reality underscoring the gravity of the situation. The abrupt nature of these cuts adds another layer of complexity to the crisis. Many programs were forced to halt operations in late January following a 90-day review initiated by the previous administration. Some received temporary waivers, only to be met with permanent closure notices just weeks later, leaving them scrambling to find alternative solutions amidst the chaos. This abruptness not only disrupts vital healthcare delivery, but also leaves thousands of healthcare workers facing unemployment, exacerbating the already dire situation. Modeling conducted by experts, such as Dr. Becker, projects a chilling scenario in South Africa. A complete loss of PEPFAR funding, a crucial component of the U.S.'s global HIV/AIDS initiative, could lead to over 500,000 additional HIV-related deaths within the next decade. Initially, there were concerns that the cuts might disproportionately target programs focused on key populations, such as the LGBT+ community, mirroring previous administrations' attacks on diversity and inclusion initiatives. However, the reality is far more devastating. The cuts are widespread and indiscriminate. While programs funded through the U.S. Centers for Disease Control and Prevention, CDC, have not yet faced the same drastic cuts, the situation remains precarious. Dr. Kate Reese, a public health specialist at the Anova Health Institute, cautions against premature optimism, emphasizing that the future of these programs remains uncertain. The current situation creates a ripple effect, impacting not only the immediate recipients of care, but also the entire healthcare infrastructure across affected regions. The potential for widespread collapse of existing healthcare systems, leaving millions vulnerable to HIV infection and its devastating consequences, is a very real threat. The global community must urgently address this crisis, finding alternative funding mechanisms and advocating for the restoration of essential support to save countless lives. The silence on this matter could be a silent consent to a global health catastrophe. The time for action is now. We must not stand idly by while this preventable tragedy unfolds.